It's important to understand, so this Bill C-47, which has just passed and became law on June 22nd, is just kind of one part of an entire plan that Health Canada has called the Self-Care Framework. We've just gone through a really long process to try and figure out how we should regulate natural health products. So for most of my life, they've been completely unregulated because we had drug regulations that really the intention was that they were for chemical drugs. And the intention that they were for chemical drugs is just because chemical drugs really have a high risk profile. You know, if you were to pick like the 6 or 7 leading causes of death in every Western nation, the top 3 would be tied to the use of chemical pharmaceutical drugs, including using them as directed. We've created this legal basis where all chemical drugs are deemed to be illegal. But in the late, mid 80s going into the 90s, Health Canada started to apply this principle, like just, okay, drugs apply now to natural products, which is kind of funny, right? I mean, you can go and buy parsley in the produce section, but if you want to dry it and grind it up and put it into a capsule, now we presume it to be dangerous and illegal, and you can't use it for a therapeutic purpose unless you get through this licensing scheme. So Health Canada is trying to take products away, and it escalates in the 1990s, and consumers rebel. And part of the Health Canada plan to treat these like chemical drugs was to bring in cost recovery. And so the citizens rebel. They start a lawsuit against the government, against this cost recovery, and the Minister of Health, Alan Rocky, backs down publicly. He holds a press conference on the eve of the lawsuit and says, we've listened to you, we've heard. He asked the Standing Committee on Health, which is an all-party committee in Parliament, will you tell us how to regulate natural health products? They have the broadest consultation in Canadian history of any standing committee in Parliament, and they say, don't treat them like drugs. People want increased access. So Canadians want increased access. They don't want decreased access. So Health Canada hums and haws for 5 or 6 years and imposes chemical drug style regulations on us called the natural product regulations. But they are softer in that we're able to use traditional use evidence to get licensed. Health Canada is basically saying, well, we're not happy with how we're doing it now. We want to actually totally harmonize our natural health products with the chemical drug model. And so there's several things they have to do this. So one is cost recovery. The Health Canada's own projection, and they agree, we haven't costed everything out here, but I think it's like 118 million they're expecting to get in the first year. So we're going to lose businesses. Every time you increase in a tight margin market, every time you increase business costs, you lose players. That's just the way it works. So some are going to become economic and drop out, and the number of product license applications will drop. So, and prices are going to increase for the products that remain. You increase the cost of doing business in a business environment where the margins are pretty tight, and then all of a sudden the prices are going to increase. Right now, natural health is a privilege of the middle class and the upper class. If you're economically disadvantaged, there's no way you're going to a naturopathic doctor or the like and buying a whole bunch of natural health products. Because that's what this comes down to, is who gets to choose how we're going to treat ourselves when we're sick. And the difficulty that we have with what's happening with Health Canada putting us into position where they're going to regulate these products like chemical drugs is we're just going to lose them. So not only do we have this cost recovery coming in, and not only do we have them increasing the regulatory burden dramatically, but other planks of this self-care framework are you're not going to be able to use traditional use evidence to get a license. Let's say the traditional Chinese medicine practitioners, their history of using specific herbs and combinations of herbs and plants for specific conditions goes back thousands of years. Same with the Ayurvedic. And in the herbalist tradition, it can go back 1,000 years and definitely centuries and centuries. You see, that's the problem, is intellectual property rights. We wouldn't spend hundreds of millions of dollars to get approval because we'd never get our money back. So like in my lifetime, For serious health conditions, you have to go through what's called the new drug approval process. Well, an average cost is $1 billion. In my lifetime, and I'm 58, there's only been one drug that's gone through that process that didn't have a patent, and that was pushed through by government money. Like, so the whole system's designed to basically privilege chemical drugs that have a patent on it. Once we move into this model where we have to run double-blind clinical trials for, you know, any serious health condition, well, then the only remedies available are your chemical drugs. And that's how they're playing this game. They're not passing a law saying natural products are illegal, you can't use them. They're just putting us in a regulatory structure where they're not going to be approved for serious conditions. There's a company, True Hope, that has a product, EMpower Plus, which may very well be the best treatment for serious bipolar disorder in the world. Like some psychiatrists, it's all they use. Because if it works, no side effects, you're not doped out. Like, it's like a light switch, you're well again. And there was a period of time, like when they first were on the market, and before you had to get Health Canada approval to be on the market, where the people using that product, by and large, were those people that would be involuntarily committed to psych wards. And once you're in that cohort where you're getting involuntarily committed to psych wards, where they drug you up on a drug cocktail, and you're actually in the hospital for months and months, solely because you're so drugged up, you're drooling over yourself 24 hours a day. And it's only when you start to get used to the drug cocktail enough that that's not happening, they send you home on 24-hour suicide watch. And then you finally get so acclimatized to the drug, you're manic and suicidal again, and then you get involuntarily committed, and they put you in another drug cocktail, rinse and repeat. Those people don't live 5 years once they're in that cohort. Like, it's a death sentence, and your life is a living hell. So those people started using this product, knowing that there was no clinical evidence, knowing that it really was all anecdotal evidence, but all the approved drugs for them were a death sentence. It was just like Strauss heart drops people, and they got well. Like, Health Canada charged them criminally, like charged True Hope criminally for selling this for treating serious mental illness. And I called these people as witnesses. And, you know, it was spooky when I was starting to call just a whole bunch to see who would be good witnesses. You know, you have as a lawyer, you've kind of got a pre-list of questions that you've thought of to ask. Well, there was one thing they were volunteering that I never thought of to ask. 100% of the people I called as potential witnesses said, you know, I had a suicide plan in place. If I was to run out of the product, I was going to kill myself while I was still well, while I was still mentally competent. I was going to kill myself rather than go back. Now, can you imagine being so sick for so long that when you get healthy again, it was so awful that you would actually have a suicide plan in place in case you ran out of the product and were going to face going back to that? Like, you'd kill yourself while you were still well. I can't imagine. And these people testified about that in court. And I called Ron Lajeunesse, who was the Alberta branch president of the Canadian Mental Health Association, who talked about this every time there was a death of a Canadian Mental Health Association person because Health Canada restricted access to the product. He would go to the funeral, and then he'd hold a press conference in an attempt to shame Health Canada. Now, where I'm going with this EMpower Plus story is there are 35 published peer-reviewed research articles on this product, all funded by governments, including Canadian governments. But governments around the world have stumped up taxpayers' money to fund research into a vitamin and mineral supplement being used as a treatment of bipolar disorder. And these publications, like some of them are the blue chip ones, like Journal of Psychiatry, Journal of Child and Adolescent Psychopharmacology. Now, True Hope had these on their website prior to June 22nd. Now, what happens on June 22nd? This budget bill passes and the penalties are increased. And this is part of the self-care framework. So prior to that, True Hope could risk sharing truthful health information with Canadians, because if Health Canada took them to court, the maximum fine was $5,000. But now, as of June 22nd, the maximum fine, listen to this, it's gone from $5,000 to $5 million per day of offense. Oh, but it doesn't matter that you're a company. Every director, every officer, every employee involved is also personally liable for $5 million a day fines. Now we have censorship because everyone is afraid of these penalties. But these are not penalties made to bring people into compliance. They're penalties that destroy people. Like in legal terms, we just call it tyranny. In my opinion, and it's just my personal opinion, is that Health Canada has been largely captured by the pharmaceutical companies for quite some time. Because most of Health Canada's budget comes now from the pharmaceutical industry, the fees they charge. And whenever you're dealing in an area of safety, public health and safety, you really shouldn't be placing the regulatory agency in a situation where there can be a conflict of interest. It's just not good public policy. I think this was just imposed from outside. Health Canada's been involved in a bunch of initiatives to harmonize how our drugs are regulated with other Western nations. And is there any other country that is doing so much at the World Health Organization to give away its national sovereignty than Canada? Like, if there is, please let me know, because we seem to be at the forefront. In 2008 and 1998, we weren't so far along with this international harmonization with other countries and with the World Health Organization. I mean, literally, we're at the point where Canada is about to enter. They're not calling it a treaty deliberately, and so maybe they'll end up calling it a binding agreement, but literally where Canada will give up its right if the World Health Organization declares a pandemic. And like, remember, they declared a pandemic over monkeypox. Was it this calendar year or last calendar year? Like, it might still be an official World Health Organization pandemic, but recently they declared monkeypox to be a pandemic worldwide, and Canada just ignored it because it wasn't a problem in Canada. But we're entering an agreement where we can't ignore it, where actually we would lose our sovereignty. So the World Health Organization would have the right to dictate to us how we're going to manage that pandemic. And the thing that confuses me about that is surely Canada has expertise within Canada. The United States is the freest. So they had a citizen rebellion in the early 90s, just as we did, and are simmered a little longer than theirs. And they forced Congress to back down. So they passed in 1994 what's called the Dietary Supplement Health and Education Act of 1994. And what we call natural health products, they're not classed as drugs in the United States. So you don't have to get pre-licensing. They're classed as foods. But you'll notice in the mainstream media, like, that the messaging is out there that these products are so dangerous, we need to regulate them. And the Auditor General just in the last year did a report just saying that, well, these products are so dangerous and Health Canada needs to have these stricter fines and needs to regulate them more. From 1965 onwards, we've been tracking pretty good adverse reactions, including deaths, to all drugs, including natural health products. Will you just accept 1965 to the date of your request? Oh, hard adder. Do you know how many deaths they were able to point out from 1965 to about 12 years ago caused by natural health products?
0 to 2, 0.
Goose egg, 0. Now, compare that with, let's take acetaminophen. So that's brand name Tylenol. So a very common over-the-counter chemical drug that probably every viewer has in their home.
Yep.
Well, acetaminophen, taken as directed, kills roughly 1 Canadian per million per year. So there's 40 million of us. So on a yearly basis, we would expect 40 deaths, and those deaths are reported. I mean, that would mean that in a single year of the use of one over-the-counter chemical drug, we would have more deaths than we could point to in all of our history of the entire natural health product industry. And that kind of shows, when they're telling us this is dangerous, that's a little bit misleading. So we can't even resist by having, underground products that are illegal, as crazy as that is. We can't have that with these fine structures, which is why they brought this fine structure in, because they know they're squeezing us out. Like I was telling you about cost recovery, like how they're imposing these fines. Well, they say in their documents, so right in the Canada Gazette where they publish the notice, and they've got a section on their website about cost recovery, they are telling us we're going to use those funds to hire more Health Canada police to enforce the new strict regulations and to go into the marketplace to look for advertising. They want to hire basically police officers to go and censor advertising. Yeah, it's interesting, the Health Canada messaging, right? Because we're left with the impression that, they're there to protect our health and all the like. And, I challenge anyone to look at the Food and Drug Act and the drug regulations, and you show me anywhere where they're charged with protecting our health, where there's any duty on them to act in the public interest at all. They're there to enforce the Food and Drug Act and regulations, and the Food and Drug Act and regulations do not charge them with protecting our health. I'm part of a nonprofit called the Natural Health Product Protection Association. The website is www.nhppa.org. We've already started one campaign to, pressure the MPs, both by in-person meetings and telephone calls and letter writing. We're going to be launching campaign after campaign after campaign. Subscribe to our newsletter so that we can inform you about actions we want you to take.